Olá, bom dia, boa tarde e boa noite. Obrigado a todos os que se juntam a nós a este webinar sobre saúde oral e cuidados abrangentes de fendas palatinas. Eu sou Susana Schaefer, Presidente e CEO da Smile Train, a maior organização mundial de lábio leporino e fendas palatinas. Hoje vão ouvir-me a mim, a especialistas em saúde oral e fendas labiopalatinas de todo o mundo, e a colegas da FDI e da GSK, para apresentar as novas diretrizes que integram a saúde oral e os cuidados dentários no continuum dos cuidados de pacientes com fendas labiopalatinas. Vou começar por detalhar um pouco o trabalho da Smile Train para explicar porque é que esta parceria entre a Smile Train e a FDI e o apoio da GSK é tão importante para nós. Como sabem, a fenda labial e ou palatina é a diferença de nascimento mais comum do rosto e da boca. As crianças com fendas podem ter dificuldade em comer, respirar, ouvir, falar e, no fim de contas, prosperar. Desde 1999, a Smile Train tem parcerias diretas com hospitais locais em mais de 90 países, capacitando os profissionais médicos locais com financiamento, recursos e a formação necessária para fornecer cirurgias e cuidados contínuos a pacientes com fendas labiopalatinas nas suas próprias comunidades. Não somos uma organização baseada em missões. Acreditamos que o aumento das capacidades dos cuidados de saúde com parcerias locais é a forma mais sustentável de apoiar profissionais médicos e pacientes, tanto agora como no futuro. Depois de mais de 2 décadas de trabalho com os nossos parceiros, após termos apoiado mais de 1,5 milhão de tratamentos cirúrgicos e milhares de tratamentos de fendas, adquirimos uma grande experiência e especialização no que é necessário para proporcionar o melhor resultado aos pacientes com fendas labiopalatinas. Há uma necessidade urgente, não só de cirurgiões e anestesistas treinados e equipados, mas também de equipas integradas de tratamento, que possam fornecer a gama necessária de cuidados ao longo da vida de uma criança. Os profissionais de saúde mundiais são uma parte crítica desta equipa. As crianças com fendas apresentam um risco acrescido para uma saúde oral deficiente. O meu colega, o Dr. Peter Mossey, irá entrar em mais pormenores acerca do impacto médico das fendas. Mas a realidade é que, sem cuidados de saúde oral dedicados, o resultado das cirurgias das fendas labiopalatinas e a capacidade dos doentes para comer, falar e viver sem dor ou desconforto está comprometida. É fundamental que todos os indivíduos com fendas tenham acesso a profissionais de saúde oral que estejam conscientes das suas necessidades e que cada membro da equipa de cuidados de saúde saiba quando reencaminhar um paciente para o seu prestador de cuidados de saúde oral. É fundamental que cada família compreenda o seu papel no apoio à saúde oral da sua criança e que cada criança compreenda como pode assumir a responsabilidade pela sua própria saúde, à medida que cresce e amadurece. A disponibilidade, qualidade e consistência destes cuidados terá impacto na sua saúde e na trajetória de toda a sua vida. É por isso que a Smile Train e a FDI, com o apoio da GSK, se juntaram para desenvolver recursos educativos, tanto para profissionais como para não profissionais. Durante os próximos 2 anos, vamos continuar a trabalhar com a nossa equipa de especialistas para desenvolver materiais que ensinem aos pacientes e famílias a importância dos cuidados de saúde oral, que expliquem os desafios dos cuidados de saúde oral para além da cirurgia da fenda e forneçam orientação e apoios vitais aos pacientes. As diretrizes que hoje apresentamos são construídas em torno da ideia de que todos os clínicos envolvidos no cuidado das pessoas afetadas por fendas labiopalatinas têm um papel a desempenhar na manutenção de um sorriso saudável. É claro que, como quaisquer diretrizes, estas só terão valor se estiverem associadas à dedicação, experiência e perícia dos profissionais médicos e podem ajudar os pacientes a viver uma vida mais feliz e saudável. Hoje, estamos gratos a todos os profissionais de saúde que mudam a vida dos seus pacientes, incluindo os pacientes com fendas. A FDI, a Smile Train e a GSK têm orgulho em apoiá-lo, como membro-chave da comunidade global de fendas, e agradecemos-lhe pelo seu trabalho. Convidamos-lo a visitar a nova página web da Smile Train para recursos de saúde oral em smiletrain.org/oralhealth, que recolhe as diretrizes e que será atualizada com os recursos educativos que vão continuar a seguir desta parceria histórica. Obrigado a todos e esperamos trabalhar com a comunidade de saúde oral para garantir que cada criança com fenda lábio-palatina tem o futuro que merece. Gostaria agora de convidar o Dr. Peter Mossey a juntar-se a nós e a apresentar as razões pelas quais, em particular, a saúde oral e os cuidados dentários são tão importantes para as pessoas com fendas. Obrigado, Susana. O meu nome é Peter Mossey. Sinto-me honrado e privilegiado por ser convidado a apresentar, em nome da equipa de peritos nomeados pela FDI e Smile Train, para desenvolver estas orientações tão necessárias. Todas as crianças, em qualquer lugar, devem ter acesso à saúde oral e a cuidados dentários, pois a sua saúde e bem-estar é um direito humano básico. Isto significa ter conselhos dietéticos saudáveis, boa higiene oral e conselhos de flúor para escovar e também acesso regular a cuidados dentários. Assim, hoje estamos a abordar um problema que aflige uma população muito especial, mas muito vulnerável, aqueles que nascem com fendas no lábio ou no palato. Por alguma razão, estas crianças são mais suscetíveis a cáries na primeira infância e precisamos compreender as razões para tal. Eis o que sabemos sobre a suscetibilidade à má saúde oral em crianças com fendas. É mais provável que tenham anomalias dentárias, tais como dentes supranumerários, dentes em falta e dentes mal formados. Para além disso, a qualidade do osso que suporta os dentes pode ser mais fino e, obviamente, nas fendas unilaterais e bilaterais existem defeitos ósseos ao redor do local. E os defeitos do esmalte também são mais prevalentes neste grupo. Em segundo lugar, os bebés com fendas no lábio ou palato são suscetíveis de ter dificuldades na alimentação. Em primeiro lugar, são incapazes de criar um fechamento completo sobre o mamilo para amamentar e, sem um aconselhamento alimentar adequado, tendem a ter mais suplementos açucarados na sua alimentação líquida. Além disso, podem ser utilizadas placas para facilitar a alimentação e estas acumulam restos de alimentos e depósitos de placa bacteriana. Há também um maior tempo de desobstrução dos alimentos na boca, o que tende a gerar açúcares fermentáveis a partir dos amidos que alimentam as bactérias da placa. Em terceiro lugar, existe uma série de outros fatores que se podem aplicar em casos individuais. Estas crianças têm menos probabilidades de aceder aos cuidados de saúde devido a problemas de privação, marginalização e ao estigma da fenda e das barreiras geográficas ao tratamento. Há também um aumento da ansiedade nas suas mentes devido à fenda e elas relatam uma menor saúde oral e qualidade de vida relacionada. E, finalmente, é mais provável que tenham um tratamento ortodôntico prolongado. Então, qual é a nossa resposta a este problema? Bem, os da FDI, Smile Train e GSK juntaram-se para dar esta resposta impressionante, para produzir um conjunto de diretrizes para os cuidadores e prestadores de cuidados de saúde. Na apresentação seguinte, a doutora Lola Oranuga vai apresentar a essência destas diretrizes que irão garantir que podemos mitigar os efeitos adversos da cirurgia, da dieta pobre, da dor e dos problemas com a fala e a psicologia ou a qualidade de vida. Assim, em conclusão, toda a ideia por trás deste projeto é apoiar os vários membros da equipa multidisciplinar para assegurar que aqueles que nascem com fendas se sintam apoiados, se sintam acarinhados e amados e que podem alcançar os melhores resultados possíveis, o que inclui um sorriso saudável e que sejam, portanto, capazes de alcançar todo o seu potencial na vida. Agora vou dar a palavra à doutora Lola Oranuga. Agradeço-vos sinceramente a vossa amável atenção. Obrigado. Obrigado, professor Mossi. Portanto, estou aqui hoje como parte do painel de peritos nomeados pela FDI, World Dental Federation e Smile Train para preparar as diretrizes para a saúde oral e cuidados completos de fendas para os profissionais de saúde oral e para a equipa mais alargada de fendas labiopalatinas. De fevereiro a julho de 2020, o professor Muthu Murugan, no Instituto Sri Ramachandra, em colaboração com o painel de peritos da equipa de peritos da Oral Health and Comprehensive Cleft Care, levou a cabo uma revisão sistemática da literatura existente e publicou diretrizes para os cuidados orais de pessoas nascidas com fendas labiopalatinas. Utilizando a ferramenta Agree 2 para a avaliação de diretrizes, investigação e avaliação, avaliou a qualidade das 7 diretrizes identificadas. Os investigadores concluíram que essas diretrizes existentes eram de qualidade baixa a moderada e não forneciam uma orientação abrangente para a equipa multidisciplinar envolvida no cuidado de pacientes com fendas. Este artigo será publicado mais tarde em 2020. A FDI, World Dental Federation e Smile Train reconhecem que todos os envolvidos na prestação de cuidados a doentes com fendas têm a responsabilidade de assegurar que o doente tem e pode manter uma boa saúde oral. Os pais ou os tutores podem precisar apoio e encorajamento extra para aprender a limpar a área da fenda e compreender como podem prevenir as doenças orais. O doente deve poder manter a sua própria saúde oral e ter apoio na sua rotina de higiene oral até cerca dos 8 anos de idade. Existem várias modalidades de classificação para avaliar a gravidade da fenda. A equipa da FDI Smile Train advoga a adoção do sistema LaSalle, que é uma classificação de base anatómica, conhecida como LaSalle, e que utiliza o lábio, L, o alvéolo, A, o palato duro, H, e o palato mole, S, para descrever as características da fissura. O primeiro caractere é para o lábio direito do paciente e o último caractere para o lábio esquerdo do paciente. O código LaSalle indica uma fenda completa com letra maiúscula e uma fenda incompleta com letra minúscula. Se não existe fenda, é representada com um traço. O sistema LaSalle é adotado porque é simples de compreender, tanto por profissionais de saúde orais como de saúde não oral. As mensagens principais estão na diretriz. Todos os prestadores envolvidos no tratamento de doentes com fendas têm uma regra para manter a saúde oral e o bem-estar do paciente. É importante que os protocolos sejam desenvolvidos e adotados para que os prestadores assegurem uma boa comunicação interdisciplinar. Os objetivos da comunicação interdisciplinar são otimizar a saúde oral e o bem-estar do paciente, incluindo a capacidade de comer, falar, respirar e engolir. Os prestadores devem apoiar os cuidadores, pois estes preocupam-se com a forma como os dentes irão aparecer quando entrarem em erupção e também com a saúde oral das crianças. Os prestadores de cuidados e tutores devem ser encorajados a aprender como limpar a zona da fenda na boca. É também importante que compreendam o que causa as doenças orais e como as podem prevenir. Durante o ciclo de vida dos nossos pacientes, eles também serão submetidos a tratamentos com muitas outras especialidades, testes genéticos, terapia da fala, terapia de linguagem, testes de audição, cirurgia e revisão cirúrgica. Toda a equipa deve comunicar regularmente para assegurar que o paciente está a receber os cuidados certos na altura certa e enviarem o paciente rapidamente uns aos outros caso tenham quaisquer preocupações acerca da saúde oral e ou desenvolvimento do paciente. As diretrizes para os profissionais de saúde oral e não oral estão organizadas em grupos etários: 0 a 2 anos, 2 a 6 anos, 6 a 12 anos, 12 a 18 anos e acima de 18 anos, e fornecem orientação para a equipa de saúde oral e não oral ao longo da vida do paciente. As principais mensagens para os profissionais de saúde oral na diretriz são a prática da medicina dentária minimamente invasiva para permitir a retenção da dentição primária e a preservação da substância dentária natural. Se estiver disponível, poderia ser utilizado o fluoreto de diamina de prata e deve ser encorajada a aplicação frequente de fluoretos tópicos. É importante que a monitorização e avaliação de qualquer cárie infantil seja efetuada nestas crianças, uma vez que qualquer cárie infantil é um fardo mais pesado nas crianças com fenda. Em cada contacto com o paciente, devem ser dadas instruções intensivas de higiene oral e modificação do comportamento. À medida que o paciente cresce, a necessidade muda de um obturador para um aparelho removível e para um aparelho ortodôntico, e as instruções também devem mudar conforme for apropriado. Os pacientes com fissuras sofrem frequentemente efeitos psicológicos a longo prazo. É necessário dar-lhes o aconselhamento e apoio adequados à medida que for necessário. É também o nosso papel como profissionais de saúde oral de lhes fornecer as próteses dentárias adequadas e proporcionar-lhes os procedimentos cosméticos não invasivos, tais como restaurações com compósitos. Quanto aos profissionais de saúde não oral, eles são capazes de avaliar o risco de desenvolvimento de doenças orais. Os itens nas avaliações de risco incluem lesões cariosas ativas ou pré-cariosas, baixo nível socioeconómico, consumo frequente de açúcares alimentares, fluxo salivar reduzido ou pH salivar baixo, higiene oral deficiente, exposição subóptima a fluoretos e fatores de risco familiares, tais como aparência de nível educacional e saúde oral dos irmãos. Devemos notar que cada item da avaliação de risco aumenta o risco do paciente ter doenças orais, e a combinação dos itens aumenta significativamente o risco de cárie e de doença periodontal. As principais mensagens para os profissionais de saúde não oral são avaliar o risco de desenvolver doenças orais e assegurar que os medicamentos prescritos não contêm açúcar. Também podemos levar a cabo aquilo que chamamos de levantar o lábio, ou lift the lip. Isto pode proporcionar uma breve intervenção de saúde oral na visita de cada paciente e coordená-la com a equipa dentária. O nosso colega de saúde não oral pode avaliar os dentes para os seguintes fatores: manchas brancas, manchas castanhas, gengivas vermelhas ou com sangramento, cáries dentárias e acumulação de placa dentária. Chamamos a isto levantar o lábio, ou como disse, lift the lip. Podem também aproveitar esta oportunidade para aconselhar os pacientes acerca da escovagem dentária 2 vezes por dia, não bochar ou cuspir, evitar petiscos entre as refeições. Eu recomendo o consumo de alimentos como iogurtes, queijo ou alimentos integrais que não favorecem a cárie. Beber apenas água ou leite entre as refeições e visitar o dentista em cada consulta. Ao longo da vida do doente, deve-se pensar numa higiene oral adequada à idade. desde o nascimento, limpar à volta da fenda com uma gasa, após cada refeição e de manhã e à noite. Com a erupção dos primeiros dentes, a escovagem assistida, e à medida que o paciente cresce, as crianças devem ser assistidas e supervisadas com a escovagem dos dentes e higiene oral até à idade de 8 anos. Durante a adolescência, onde serão submetidos a tratamentos ortodônticos e têm aparelhos, a técnica de escovagem deve ser ensinada para manter o aparelho limpo e, na idade adulta, podem ser submetidos a procedimentos restauradores avançados, tais como trabalhos de prótese fixa ou implantes. Isto requer cuidados domiciliários especializados para a manutenção e prevenção de problemas graves mais tarde. Como profissionais de saúde oral, temos o dever de manter a saúde oral e o bem-estar dos nossos pacientes. A FDI, Smile Train, com o apoio da GSK, tem o prazer de divulgar hoje estas diretrizes para melhorar a saúde oral das crianças nascidas com fendas. Vou agora passar a palavra ao Dr. Gerhard Seeberger, presidente da FDI World Dental Federation. Obrigado. Obrigado, doutora Oranuga. Boa tarde a todos. Estou encantado por terem podido juntar-se a nós para este webinar de hoje. Gostaria de começar por vos dar um breve historial do nosso trabalho de apoio à saúde oral e aos cuidados dentários para crianças nascidas com fendas. Em 2019, a FDI World Dental Federation teve o prazer de fazer uma parceria com a Organização de Saúde Oral Sem Fins Lucrativos Smile Train para melhorar os cuidados orais a pacientes com fendas. Com o apoio da GlaxoSmithKline, conseguimos lançar o projeto de Saúde Oral e Cuidados Integrados de Fendas Labiopalatinas, que integra profissionais de saúde oral no continuum de cuidados de fendas. O projeto também fornece recursos educacionais a profissionais de saúde oral para a equipa mais ampla de cuidados de fendas, para os pais e para os prestadores de cuidados de saúde. Hoje, estamos entusiasmados por apresentar o trabalho de uma equipa global de especialistas que colaboraram na produção de diretrizes de saúde oral e de cuidados abrangentes de fendas. Estas diretrizes fornecem uma orientação completa acerca de como prevenir doenças orais e manter uma dentição funcional, natural e saudável para as pessoas nascidas com fendas. As crianças que nascem com fendas labiopalatinas apresentam um risco significativamente mais elevado de sofrer de cárie dentária e doenças periodontais. Muitas vezes, mesmo quando recebem uma cirurgia essencial, ainda têm dentes em falta ou malformações dentárias. Como profissionais de saúde oral, estamos conscientes do impacto a longo prazo que as doenças orais têm na saúde oral, no desenvolvimento e no bem-estar de crianças e adultos. Compreendemos a necessidade de cuidados de saúde multidisciplinares abrangentes e, para apoiar esta integração, os profissionais de saúde oral devem receber orientação e formação precisas e de qualidade no cuidado das pessoas com fendas. A FDI World Dental Federation, como representante de mais de 1 milhão de dentistas em todo o mundo, juntamente com a Smile Train e com o apoio da GSK, estende a sua sincera gratidão a toda a comunidade de cuidados de saúde oral pela sua dedicação contínua para enfrentar a carga global de doenças orais e melhorar ou ajudar estes pacientes. Obrigado por se juntarem a nós. Todos os anos, mais de 200 mil bebês nascem com lábio leporino e ou fenda palatina. As crianças com fendas têm um risco aumentado de cáries, doenças periodontais e outros desafios de saúde oral à medida que crescem e se desenvolvem. Mas, em países de rendimento baixo e médio, muitas destas crianças não têm acesso a cuidados de saúde oral básicos. Sem cuidados dentários contínuos por parte de provedores familiarizados com as suas necessidades únicas, as crianças com fendas podem ter dificuldade em falar e comer e a falta de cuidados adequados pode mesmo ameaçar o sucesso de futuras cirurgias. Desde a primeira consulta de cuidados preventivos até aos cuidados ortodônticos e protésicos, os cuidados dentários de alta qualidade são um tijolo na construção de um futuro feliz e saudável para as crianças com fendas. Os dentistas são membros essenciais da sua equipa de cuidados. É por isso que a Smile Train e a FDI World Dental Federation, com o apoio da GSK Consumer Healthcare, uniram forças para lançar o projeto de saúde oral em pacientes com fendas. Juntos vamos fornecer orientações e recursos educativos para profissionais de saúde oral e não oral que respondem às necessidades de saúde oral de pacientes com fendas. Juntamente com a comunidade de saúde oral, vamos trabalhar para aumentar o acesso aos cuidados essenciais e assegurar que nenhuma criança seja deixada para trás. Smile Train, a FDI e a GSK orgulham-se de reconhecer e apoiar os profissionais de saúde oral como membros-chave da comunidade global de fendas labiopalatinas. E aos inúmeros profissionais de saúde oral que estão a mudar as vidas das crianças com fendas todos os dias, obrigado. Obrigado, Gerhard, e boa tarde a todos. Este vídeo demonstra realmente o papel vital que os profissionais de medicina dentária desempenham na melhoria dos cuidados a quase 200 mil bebés nascidos todos os anos com fendas labiais ou palatinas. Um papel que nós, na GSK Consumer Healthcare, estamos verdadeiramente honrados por apoiar. Na GSK, a nossa equipa está empenhada em combater problemas de saúde oral evitáveis com produtos e serviços de base científica. Acreditamos verdadeiramente que a nossa boca deve ser uma fonte de alegria e não de dor. Portanto, partilhamos um objetivo comum com a Smile Train e é por isso que há cerca de 2 anos e meio formamos uma parceria para ajudar a melhorar os cuidados para as pessoas que sofrem de fendas de lábio ou de palato, a fim de lhes permitir levar uma vida mais plena e saudável. Para nós, trata-se de fazer bem, fazendo o bem. Nos últimos 2 anos e meio, orgulhamos de ter possibilitado cerca de 8 mil cirurgias que transformaram a vida destes pacientes. Também patrocinamos o programa abrangente de cuidados de fendas labiopalatinas, destinado a proporcionar cuidados holísticos e contínuos a estas pessoas. E acreditamos no modelo sustentável da Smile Train e, por isso, investimos nos seus esforços para educar e capacitar quase 2 mil dentistas, cirurgiões, enfermeiros, anestesistas, terapeutas da fala e nutricionistas em 52 países do mundo. Na GSK, estamos orgulhosos da nossa associação com a FDI. Ao longo dos últimos 10 anos, temos realizado, em conjunto, iniciativas orientadas para a ciência, como o Projeto Global de Saúde Periodontal e o Observatório de Saúde Oral. Assim, juntos, neste projeto para permitir melhores cuidados de fendas, estamos verdadeiramente orgulhosos por termos feito uma parceria com a FDI e a Smile Train para o desenvolvimento de diretrizes de saúde oral e cuidados abrangentes de fendas, que estão a ser divulgadas hoje. Sabemos que as pessoas com fendas labiais ou palatinas têm um risco significativamente maior de sofrer de cárie dentária ou doenças periodontais. Mas isso não tem de ser o caso. Ao proporcionarmos aos profissionais dentários como vocês recursos baseados em evidências, podemos proporcionar em conjunto melhores cuidados às pessoas com fendas labiais ou palatinas e ajudar a melhorar a sua vida e a vida das suas famílias. Estas diretrizes sobre a prevenção de doenças orais em pessoas com fenda labial ou palatina é outro grande passo na nossa jornada conjunta para conectar os profissionais de medicina dentária a pessoas que sofrem de fenda labial ou palatina. Estamos a iniciar um projeto piloto na Índia que será seguido muito em breve por outros projetos piloto no México e na Nigéria. Ainda há muito por fazer e, ao trabalharmos em colaboração com profissionais de medicina dentária como vocês, acreditamos verdadeiramente que podemos fazer uma diferença positiva significativa. Gostaria agora de passar o webinar ao Dr. Peter Mossey, que os vai acompanhar até à sessão de perguntas e respostas. Muito obrigado.
So thank you very much, everyone who has joined today's webinar. And you will note that we now are ready to accept questions. We've got myself, Peter Mossey. I've got Dr. Lola Oranuga, Dr. Susanna Schaefer. And I'm going to start off just briefly with Dr. Gerhard Seeberger, who is the president of the International Dental Federation. And I think today you're witnessing a unique collaboration between organizations to make this possible. And I'm going to ask Dr. Seeberger just to just explain how this came about, this unique collaboration.
Yeah, thank you, Peter, for introducing me so nicely, and thank you to Lola and to Susanna for being with me. And why is it that we are sitting together? So let me tell you a little story. Since 2018, GSK Healthcare is a strategic partner of SmileTrain. And it's not only that they gave financial support to SmileTrain for their global cleft programs in order to bring smiles to so many people around the world, but they also support global awareness building around cleft lip and palate and oral health. And part of SmileTrain's strategic plan is to expand their programs to offer every facet of comprehensive cleft care to every patient in need. And this includes a 360 degrees oral health care. To support this plan, GSK arranged an incredible opportunity introducing SmileTrain to the long-standing partner, the FDI World Dental Federation. And we were very happy. I need to tell you that. There's a huge need for high-quality comprehensive resources on cleft care and oral health. And as SmileTrain and FDI share their passion for enabling healthy, happy lives through all healthcare, it was almost a must to come together to address this need. With GSK's crucial support, SmileTrain and FDI have joined forces to support people with clefts and medical professionals through this groundbreaking two-year project. So that's all what I can tell you so far, and I give the word back to Peter.
Thank you very much, Gerhard. And we're delighted to see so much contribution through the chat box, and we will now proceed to take your questions. And between this panel, we will hopefully be able to elaborate further on these guidelines and other aspects of comprehensive cleft care. The very first question, in fact, is an interesting one, just asking about percentage of babies born worldwide with the condition of cleft lip and palate. And of course, the orofacial clefts are a broad and a range of different conditions, and totally, when they're taken as a whole, account for 1 in 700 live births. That's an aggregate statistic across the world, and there is variation. As one of the other questions asked, is there a world map that shows the variation? And indeed there are world maps, one of which is on the FDI Vision 2020 website that you can maybe access. But it shows that the highest rates of cleft lip and palate in the world tend to be in the eastern areas, Japan, China, parts of India seem to have high prevalence. The lowest rates in the world, interestingly, are in Sub-Saharan Africa, and then intermediate rates among the Caucasian populations, Hispanic populations, and therefore there is geographic and ethnic variation. So I'll take the next question in relation to, it's a clinical question about treatment planning, and that will be something of interest, great interest to Lola, and I'll ask her to deal with treatment planning in cleft care in oral health.
Well, thank
Lola.
you very much. Thank you very much, Peter. Yeah. This question has to do with what are the things we should keep in mind while treatment planning? We should note that as oral health professionals, the role of the dentist is very essential, especially where preventive care is concerned, prevention of oral health diseases, in particular dental caries, which is of a greater higher burden in these children. And then more importantly as well, they have a lot of other problems that come into play there. The speech, psychosocial, and a lot of concerns about eruption of teeth. A number of these items are dealt with in the guidelines and are available online at the SmileTrain website, as well as the FDI website in English. So, and most importantly, as oral health professionals, we should collaborate effectively with the other care providers in making sure that these children get the best at the right time. I hope that answers that question.
That's very good signposting to the guidelines, and I'll just move on to the very interesting question that relates to the high incidence and the access problems in places where they are low to middle income countries such as India. And in fact, a similar question arose in the context of Sub-Saharan Africa or Nigeria. So I will. I know that Susanna is very interested in this particular aspect, and if I can ask Susanna to respond.
Sure. Thank you, Peter. So if there's more need to understand more, you can always visit SmileTrain India or SmileTrain Africa's program websites. It would either be smiletrainindia.org or smiletrainafrica.org. And there you can find information about hospitals that partner with SmileTrain. At some hospitals, SmileTrain offers grants to cover patient transport to and from treatment, including surgery, speech therapy, and orthodontics. Dental care grants are not yet available. However, the goal of the new oral health and comprehensive cleft care guidelines and the upcoming education resources from FDI, GSK, and SmileTrain is to set the foundation for this grant program in the near future. So please stay in touch with SmileTrain to learn more as these become available. And again, you can visit either websites, smiletrainindia.org or smiletrainafrica.org.
Thank you very much, Susanna. And
Sure.
let me take the next question myself. It's related to the diagnosis before a child is born. And we refer to that as prenatal diagnosis. And indeed, it is possible through ultrasound to identify a cleft as early as 12 to 15 weeks. The difference, however, is that while a cleft lip is easily diagnosed by skilled ultrasonographers, cleft palate is not so visible. And indeed, the cleft palate may not be diagnosed until birth or even after birth. But also a range of syndromes and craniofacial abnormalities as well as clefts can be diagnosed in advance. The value of this is the psychological preparation of the family, and they can be prepared for the birth of a child that has this repairable birth defect. And that's extremely important in the comprehensive cleft care, to be prepared for that and to ensure that the family are psychologically prepared, but also have a program of care available. So I'll move from that to another question, which I think is extremely important. It asks about after surgical treatment. What's the value of comprehensive care and good oral health care? And again, Lola may want to contribute to that answer, and I can also add, but Lola, post-surgical care.
For post-surgical care, there are quite a number of problems, apart from the orthodontic aspect, the dental anomalies, the speech, the psychosocial, so the important thing here is we should have agreed protocols in the facilities, and at the same time, effective interdisciplinary collaboration between the experts, and most importantly, the question says why they have to take more concern about it, because because the speech problems and the psychosocial problems that these patients have, so it's very important that they address early, and in particular for the oral health aspect, the emphasis is on prevention, because we don't want to have them developing concerns for need for extractions that will warrant them to have prostheses that are very difficult to manage. So as much as possible, it's better to have prevention is very key. And then the orthodontic aspect too, malocclusion is very important. And all this as well are on the guidelines, stated on the guidelines as well. So, yeah.
And just adding, as an orthodontist, as an orthodontist, I know that one of the key words we always say is that the bone is gold and the teeth are even more important than that. So it's very, very important that we have excellent dental care and good quality of teeth and bone, so as to have the optimum outcome. So the prevention aspects that we deal with, even prior to having orthodontic treatment carried out and braces fitted, we ensure good oral hygiene through toothbrushing, regular fluoride applications, and good dietary advice, avoiding sugars and refined carbohydrates. Yeah, and as Lola has just very nicely said, this multidisciplinary communication is so important, so that all aspects can be addressed simultaneously for the best possible outcomes. So we also are now having additional questions, and one that I will ask Susanna just to address is how to join Smile Train as a dental professional. Would you be able to address that, Susanna?
Sure. Well, our programs are cleft focused, and dental care is obviously being incorporated into our programs. So the best way to stay connected is by visiting our websites, which I had mentioned earlier. So there's smiletrain.org/oral health. And then our regional websites I had mentioned before, smiletrainindia.org and smiletrainafrica.org. We also have websites for Asia, or China, excuse me, and the Americas region. But everything connects back to smiletrain.org. But that is where you can find access to the list of our partner hospitals, and be connected to a Smile Train staff representative who is on the ground or managing a region of countries that can help direct you to our partners. And as we start to bring along our dental programs within our Smile Train Cleft programs, we will be having opportunities to connect with dental care providers. So we're very, very excited for this, and we're so grateful to FDI and to GSK for this wonderful opportunity.
Thanks, Susanna. And actually, the next question from Dr. Professor Ghani from Pakistan is about the contribution of GSK helping the training of general dental practitioners. And maybe Gerhard, in terms of FDI and GSK, the GDP input, I know that's addressed in our guidelines, but you may want to elaborate.
Yes, I mean the domain of the oral health, of the general oral health professional or general practitioner is quite clear to everyone. Take care of the hard and soft tissues, of course. Take care of an adequate hygiene, as you already said it before, Peter. Of course, also dietary advices to stay away from refined carbohydrates and added sugar products. And if you go to processed products, you will probably sometimes wonder that you find sugar also in salad added, and sugar-sweetened beverages. To this, I may add the function of the general dental practitioner. He should definitely be the coordinator between the specialists in order to guarantee the best assistance and care for patients with cleft palate. I would also at this point enlarge a little bit the not only specialists from the medical profession, but as we look also at the assistance during the growth of this child, and of course also through the educational period. So maybe also try to get in touch with speech therapists and not leave that individual to inequalities during the educational part.
Yeah, thank you very much, Gerhard. That's excellent to have that perspective from the general practitioner's viewpoint. Just to address maybe fairly quickly the age of treatment for cleft lips and palates, and also types of surgical procedures. Those are two very good questions. Isolated cleft of the palate is usually treated as early as 6 months, but as late as 12 to 15 months in current practice. And for cleft of the lip, the usual protocol is to close the lip as soon as the child is thriving and is fit for surgery. That's usually around 3 months. So 3 months for a lip closure and 6 to 12 months for a palate closure. In terms of the surgical procedures used to get better success rate, that's an interesting question from the research point of view. And of course, one of the things that Smile Train have recently done is they're really concerned that to improve the quality of cleft care and the surgical and non-surgical care, research is extremely important, research and innovation. So there are currently ongoing efforts to look at how successful the treatment is at the different ages and using different procedures. And that research will be ongoing to improve quality of care as we go forward. And there's one other question I'm noticing about the how can we reduce dental caries and periodontal problems in cleft lip and palate patients? And while Lola has actually addressed that earlier in terms of dental caries, could you also mention the periodontal problems, Lola?
Well, the periodontal problems they have, gingivitis. You have gingivitis. Can have this can if care is not taken, can lead to, especially in Africans, you can have acute necrotizing ulcerative gingivitis as well. ANO, that we refer to ANO. And really, the important thing here is that early prevention, so that you don't have the problem coming up. So we educate them about oral health practices, toothbrushing, cleaning the area, the cleft area clean after every feed and morning and night. And then as the child erupts the teeth, supervised and assisted toothbrushing until the child is of age of 8. And after that, adolescent, age-appropriate devices to be used, toothbrushing. And then when they go through orthodontic treatment as well, you should realize that they'll be having appliances, removable and fixed appliances. They should be taught how to clean the appliances so that they don't have concerns, breakthrough issues later. And then furthermore, they may also have implants, things that are more elaborate, and then these ones actually require special home care as well. So they should be taught how to take it. There should be a protocol on handling these devices, appliances when they do come. So the emphasis is on prevention, you know. So yeah, and being educated on the dietary advice, also dietary counseling, the tooth-friendly foods that are advisable, like fruits, yogurt, and avoiding sugary foods. And then for medications, because a lot of these children are prescribed medications, emphasis for the our medical colleagues to prescribe medications that are sugar-free. Yeah.
And that helps
the importance of fluoride as well. The importance of fluoride. Exactly. And if available, use of silver diamine fluoride, especially in the primary dentition. To preserve
and that also helps address the question I see that what is the role of the dental hygienist? The dental hygienist, of course, can assist with those aspects that Lola has just outlined. So there's a very special role for the dental hygienist in those. And there are some other aspects that Lola has just addressed, like the one relating to pediatric dentistry input. And it's nice to see that there's such enthusiastic interest to help. You know, those from Nigeria and India are offering, you know, their services in helping with cleft lip and palate prevention and care. The predisposing factors that lead to cleft lip and palate, again, a very interesting question, and of course one that's subjected to comprehensive and global research over the last few decades. And we are learning more and more about both genetic and environmental factors that contribute. So cleft lip and palate is a polygenic multifactorial disorder. So there are contributions from the genes, so genetic influence, and also from these environmental factors such as diet. People often hear about the role of folic acid. This goes beyond folic acid. There are a whole range of other factors in the diet that may be important, multivitamin supplements. There's also the avoidance of smoking in particular and contaminated environments. It may not just be active maternal smoking, it's the exposure to passive smoke or the exposure to contaminated environments. And other predisposing factors that we know about are certain drugs and medications. And these should be part of the prenatal preparation for pregnancy. But in the whole, these genetic and environmental factors can be handled by improving our knowledge, improving our research, identifying the predisposing genes, which we're doing through global research, and then tailoring the environmental factor to minimize the risk. And that's something which I am very interested in and I'm working with colleagues to address. The next few questions relate to cleaning and oral hygiene, which I think we've dealt with. And then there's an interesting question that asks about our system for classification, the LaSalle. And I think both myself and Lola are very familiar with this. Lola, do you want to explain it?
Okay. Yeah. Okay, the LaSalle is an anatomical based system, and I think FDI GSA Smile Train adopted it because it's easy to understand by both oral health and non-oral health professionals. The L stands for the lip, the A for the alveolus, the S for the soft palate, H for the hard palate, A for the. So looking from the first L, that's when you're facing the patient. The first L, that's the patient's right. That's the left lip, the right lip, sorry. And then the last L on the other side is the patient's left. Okay. Now, when the you have it in capital letters, L, it means that you have a complete cleft of that L. So if it's on the patient's right, that's complete, and it's in capital L, it means that it has a complete right cleft lip. Okay? So, and but if it's in a small letter, it means that it's incomplete. So when you see capitals, it's complete cleft. If it's lowercase, it's incomplete. But when there is no cleft at all, you have a dash. I think that's it.
That's a very excellent.
I'm trying to make it as simple because I don't.
That's tremendous, and the way you've explained it, it shows how logical it is. It's really easy for anyone when they see a picture to be able to apply the LaSalle score, and I think that's the beauty of it. And we're certainly happy to promote that through Smile Train, FDI, and these GSK guidelines.
In addition, the LaSalle tool is very good for research because it allows for coding on the computer. I read that somewhere. Yeah.
And what I describe as subphenotyping, so that we have separate types of clefts and separate groups. So you can, and I think that's going to be extremely important when we're looking for genetic predisposition. So it's an important classification.
Yeah.
A simple answer to the gender predilection, again, a very interesting question, but in fact, clefts are characterized by gender biases because isolated cleft palate is more common in females. So about 2/3 of females in the isolated cleft palate incidence, whereas cleft lip and palate is more common in male infants. So there is this gender bias, which we don't really understand. We know it must have a genetic origin because it is so consistent across different populations. So about 70% of cleft lip, either isolated cleft lip or unilateral cleft of the lip and palate, are on the also on the left side. So there's the male predilection and also this the left-sided predilection. There is another question about the aids given to patients of cleft lip and palate by the dental professionals. And again, I'm sure Lola and Susanna and Gerhard would say, if you look at those guidelines, you'll see a comprehensive reference to the kind of aids that we advise. And some of them have been mentioned in the webinar, and also the kinds of treatments, such as the silver diamine fluoride, and those are comprehensively covered within the guidelines. So let me just get to the next couple of questions. Procedures to know about cleft lip or palate intrauterine life. I'm assuming that may be referring to the possibility of intrauterine surgery. Is that what you read from that?
Which question is that?
Procedure, there's one about procedures known for cleft lip and palate and intrauterine life. Well, I do know that this has been speculated as because of scar-free wound healing as a possible method for treatment of clefts, but the big risk and danger is spontaneous abortion after a surgical intervention, and therefore it's not recommended. So we wait until the child is born and carry out the cleft repairs then. And then risk factors that cause morbidity after operation or procedure or surgery. Of course, there are problems ongoing after the surgical repair. And maybe one of the ones that's being referred to there are things like hearing problems, speech problems, the cleft, the alveolar cleft, which is a deficiency of bone, which causes a problem. And then there's the psychological and psychosocial problems. So there are ongoing problems even after the cleft repair. But those, by comprehensive multidisciplinary treatment, can be very effectively managed. So those risk factors or those causes of post-operative problems can be managed. And that's also the growth of the face can be reduced because there's scar tissue in the lip and there's scar tissue in the palate. So again, those growth problems can be addressed using orthodontics, orthopedic procedures, and surgical procedures. So again, we know that we're getting better and better at improving the post-surgical treatments and management. Now, does anybody else want to comment on that before I move to there's a consanguinity question that I would also be happy to comment on. Is it?
Peter, I would just add on that. Smile Train's model of sustainability and building capacity in countries immediately addresses what you had just brought up there, in that, you know, our goal and adding in this component now for dental care with the FDI and GSK partnership is just going to help us in the breadth of our programs and what we can support our partners with in low and middle income countries to build comprehensive cleft care programs in their own communities to treat cleft children with ongoing care. So the Smile Train model of empowerment and providing the funding and resources to medical professionals, orthodontists, dental practitioners, building that full comprehensive cleft care team, including the surgical components, psychosocial, nutritional support. It all comes together in a sustainable model. So we're thrilled for this partnership to now be adding the dental component, and are excited, so excited for what's to come in this next year.
Yeah, exactly. We're all looking forward to continuing the partnership and to having Smile Train work with FDI as we go forward, and with all the tremendous support that we've received from people within other sponsored programs. And GSK are a good example of a highly motivated group who have oral health as their major component. So it's a great partnership to build on. There is a question. Yeah.
Their message is doing well by doing good, and this is exactly that. So we're incredibly grateful.
Yeah.
Yes.
There's just one I just may have the question on the high prevalence of clefts in Sub-Saharan Africa. I may have made a mistake, or else I'll correct it now. The prevalence in Sub-Saharan Africa is actually low. It's the lowest in the world in terms of the recorded clefts. We do also recognize that the ascertainment, as we call it, the diagnosis of all cases as they are born varies in different parts of the world. So the infrastructure for picking up every cleft that's born varies. So maybe, although the recorded prevalence is very low, or rather low in Sub-Saharan Africa, it could be that we're not picking them all up, and we want to continue to improve that aspect of our care as well, to make sure that systems are in place to improve the ascertainment. And the good news on that is that the Sustainable Development Goal Programme has, as part of SDG 3, an aspiration to universal health coverage. And that means that accessibility, availability, and affordability of treatment are its primary objective. So the universal health coverage is receiving a lot of high-level attention at the moment in not just FDI, but also in WHO and in IADR, the International Association for Dental Research. And they want to come together as a partnership to ensure that the Sustainable Development Goals are delivered by 2030. And that would improve access in the most deprived areas of the world. So I think we've another question on the guidelines, which it was addressed earlier on, that we do have both in the FDI and Smile Train sites, we have reference to those.
That's correct. They are translated on the Smile Train website now, and FDI is in English, but translation will be coming.
Right.
Yeah. Very good.
Okay, there's a question for me here.
Oh, yes. Yeah, please, Lola. Yes, the one on education.
No, it says dental home.
Oh, yes. Yeah, please.
It's like, would it also be, okay, yeah, the question about dental home, actually, as pediatric dentists, we advocate that as early as possible, the child should be taken to see the dentist, preferably before the first birthday or as soon as the first tooth erodes. And it's very good that a dental home is established by the time the child is 1 year old, so as to encourage, familiarization with dental practice. It's very important, and it's a great long way to support children with clefts. And at the same time, the non-oral health professionals can also encourage them to visit the dentist, apart from doing the lift the lip that was mentioned.
Indeed, yeah. And actually, I see a question referring to the reasons for cleft children being more likely to have oral health problems and dental caries. Do you want to say something about that as well, Lola?
Well, because of the anatomy of the cleft, you could have food debris around that area, or the milk around that area, and if the caregivers are not cleaning properly, that could lead to predisposing the child to oral health problems. And then moreover, we talk about medications that they're being given regularly, especially if they're sweetened medications, which will also be an avenue. And the fact that the parents are so concerned and overwhelmed, they may not be doing the right thing at the right time, doing the oral hygiene practices, effective oral hygiene practices, taking care, and they're so worried about the oral health problems. They don't know what to do. They don't seek treatment, or they're, I want to put this nicely now. They refuse to seek care because for some countries, especially the developing countries, you find out that there's a lot of taboo around this type of things, and they may not seek oral health care, and the child is more or less abandoned, and the oral health suffers. So it could be one of the reasons that they are prone, apart from the other ones I mentioned.
Yes, indeed. Yeah, there's the stigma, and that has been a problem identified both in India and in Nigeria.
Mm-hmm.
Yeah,
correct.
There's an interesting question about folic acid therapy, and I'll just try to answer that as well, because it is one of the contentious areas in cleft lip and palate. We know that folic acid is extremely important in reproductive health, and we know, for example, that for neural tube defects, that 400 micrograms of folic acid per day in the periconceptional period will reduce the risk of spina bifida and neural tube defects by 70%. So that's a huge effect. that led to a lot of research on whether the same might apply to cleft lip and palate. And unfortunately, the results are not as effective for cleft lip and palate in terms of prevention compared to neural tube defects. There is a marginal effect, it seems, and there's an even more comprehensive effect when you consider multivitamin supplements. So not just folic acid, but other supplements. But a lot of the studies that have looked at this in different countries have come across what's called confounding factors. So the possibility that the folic acid might appear to be working could be due to just a range of other healthy lifestyle choices. Because they're taking folic acid, they may also be highly aware of other risk factors. And they also may have more access and availability to these medications and supplements. So it's difficult to say, but in the countries in the world that introduced folic acid fortification and as part of dietary staple food like flour and like milk, as they did in Ireland and like in rice, they do have a slight reduction in the prevalence. So there could be a marginal effect for folic acid, but what I'm saying is it's really important to take folic acid for reproductive health in general. But different countries may have other factors, environmental factors that also contribute, and even dietary factors. For example, I'm aware in India that polished rice actually removes some of the multivitamin benefit. And rather than eating white rice, it's probably better to be eting the brown rice. And these are subject to ongoing studies to look at the role of diet and prevention of oral clefts. So, and then prevention practices are mentioned there, and prevention both in the context of preventing the cleft, but also in the context of preventing the dental and oral disease. So, there's a lovely compliment there to Lola. The question goes to you. I particularly appreciate
snacking in between meals.
Oh yeah, you've actually mentioned that one earlier.
Yeah, I think I talked about it.
Yes. Can avoiding consanguinous marriage prevent incidents? Again, I'm happy to make a brief comment on that one because we did a systematic review looking at consanguinity, and yes, it does increase the risk. We're also very well aware that there's a range of social and cultural aspects to consanguinity, but it is a scientific fact that gene pools, if they're closely aligned, can result in double recessives coming together, and if that is a component part of craniofacial anomalies, then it increases the risk. I did mention earlier the geographic variation, so and said that the reasons for that are largely unknown, but there are regional, geographic, and ethnic differences in the prevalence of both cleft palate and cleft lip and palate. Okay. The mention of Smile Train and its efforts in Nigeria is mentioned, and indeed I think we're well aware of the tremendous support for not only Nigeria but other parts of Sub-Saharan Africa now that Smile Train have been doing a lot of good work also in Ethiopia and Ghana and other parts of Sub-Saharan Africa and Kenya. Yeah. Okay. Cleft orthodontic treatment. There is a question about adult orthodontics, and indeed that is another very important aspect of our ongoing attention. Very often it's regarded as a childhood problem, but indeed these problems can persist into adulthood, and our restorative dentists are very well aware of the need for ongoing restorative treatment, maybe even obturators for facilitating speech and eating in adults. So adult orthodontic and restorative treatment can still be done at any age, really. So now, does anyone else want to I think we've come on our chat box to the end of the questions online. And we're very happy to continue, obviously, to support all of those who not only were participating in this webinar, but if you do have questions that arise after this event, then please make sure that you pass these to us and to our colleagues. We're very happy to continue to support this initiative. And of course, the guidelines, we will be using those to good effect for improving cleft care around the world from now on. One other thing that I'll just ask maybe Susanna to comment on, because we want to ensure that we are offering and providing support, is the offer of grants to partners who want to become involved in cleft care around the world.
Yes. So at the moment, SmileTrain does not offer grants, but the goal of the new oral health and comprehensive cleft care guidelines and the upcoming education resources from FDI and SmileTrain with the support from GSK, this is to set the foundation for this grant program in the near future. So please stay in touch with SmileTrain to learn when these become available. Thanks for asking, Peter.
Yeah, and that means that the volunteers can come forward to provide or offer to provide cleft care.
Correct. Yeah, that's correct. And the best is to get in touch with SmileTrain partners, SmileTrain staff. Again, we've shared the websites, smiletrain.org. / oral health care is where you can find the guidelines and also any opportunities to connect with SmileTrain around the world.
And I think maybe that's a very good place to thank everyone for their participation in this. And on that very positive note, we can just recommend everyone to continue to keep abreast of all the developments that we are suggesting through our guidelines and all of the improvements to ensure that kids are giving the best possible opportunity in life, and that a cleft is no barrier to a fruitful and productive life. And that's our major message. So to keep everyone smiling.
Yeah.
Okay, thank you very much.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you, of course, and please allow me to thank, of course, all those present, Lola, Susanna, Peter, of course, our supporters, Smile Train and GSK, and how can I forget all those who have worked in the task team? So let me just nominate them, each and every one. This is, of course, you, Peter. This is Professor Mutu Murugan. This is Professor Lachsen Usehal. This is Dr. Yan Shi from China. And, of course, our staff with the executive director and the staff in Geneva. Many, many thanks. And to all the colleagues, please make a large use of the guidelines in order to help most of people around the globe to have a better life. Stay all safe, and thank you once again.
Thank you very much, Gerhard.
Thank you.
Goodbye.
Thank you, Gerhard.
Bye.
Thank you. I just would
Bye.
like to just add one more thing to invite everyone to celebrate World Smile Day with us. That is upcoming this Friday, October 2nd. This is a day that Smile Train embraces to raise awareness for cleft and you know, to highlight our partnerships. So along with GSK, we'll be celebrating this Friday. You can visit our website, join us for our live event, which starts at 8 p.m. on Friday, October 2nd, and come along and smile with us.
Thank you, Susanna.
Thank you.
Thank you.